Comprehensive Guide to Impingement Syndrome. The video is created by Dr. Abhinav Gupta and team. In this video we have covered everything about the topic from initiation to the end. Impingement syndrome, also known as shoulder impingement, is a condition where the tendons of the rotator cuff and the subacromial bursa, a fluid-filled sac, become compressed or irritated. This tendon passes through the narrow space beneath the acromion, a bony prominence of the shoulder blade. This impingement can lead to pain, inflammation, and limited range of motion in the shoulder. Causes: repetitive overhead activities, such as throwing or lifting. It can affect people of all ages, from athletes to those with jobs involving repetitive arm movements. Clinical features of impingement syndrome. 1. Pain, persistent shoulder pain, often on the outer side or front, especially during overhead activities or reaching behind the back. 2. Weakness, difficulty in lifting or rotating the arm, indicating a loss of strength. 3. Limited range of motion, reduced ability to move the shoulder through its full range, especially during specific movements. 4. Painful arc of motion, pain experienced during a specific range of shoulder movements, typically between 70 and 120 degrees of abduction. 5. Tenderness, tenderness over the front or side of the shoulder, especially when pressure is applied. 6. Crepitus, a grating or crackling sensation may be felt or heard during shoulder movement. Grading of impingement syndrome. Impingement syndrome is often graded based on the severity of symptoms and findings. While grading systems may vary, a common classification includes: 1. Stage I, early or mild. Inflammation and edema of the rotator cuff tendons and subacromial bursa. Symptoms may be intermittent with mild pain and minimal loss of function. 2. Stage 2, moderate. Progression with fibrosis and tendinitis. Increased pain, reduced range of motion, and weakness are more pronounced. 3. Stage 3, severe or late. Presence of structural changes such as rotator cuff tears. Persistent pain, significant functional loss, and more advanced degenerative changes. Grading helps guide treatment decisions and provides a framework for understanding the progression of impingement syndrome. Early intervention, often involving physiotherapy and conservative measures, is crucial to prevent the condition from advancing to more severe stages. Individuals experiencing symptoms of impingement syndrome should seek medical evaluation for an accurate diagnosis and appropriate management. Investigations for impingement syndrome. 1. X-rays, to rule out other causes of shoulder pain, such as arthritis or structural abnormalities in the bones. 2. Magnetic resonance imaging, MRI, provides detailed images of soft tissues like tendons and can reveal the extent of rotator cuff injuries or inflammation. 3. Ultrasound, dynamic imaging that can assess the rotator cuff tendons and subacromial space during shoulder movement. 4. Arthrography, injection of contrast dye into the shoulder joint followed by X-rays or MRI to visualize the structures and identify any abnormalities. Management. 1. Anti-inflammatory medications, NSAIDs, nonsteroidal anti-inflammatory drugs can help reduce pain and inflammation. 2. Corticosteroid injections, direct injection of corticosteroids into the subacromial space can provide temporary relief from inflammation and pain. 3. Activity modification, avoiding or modifying activities that worsen symptoms, especially overhead movements. 4. Rest and ice, resting the affected shoulder and applying ice can help reduce inflammation. 5. Supportive bracing, using a shoulder brace or support to stabilize the joint and relieve pressure. 6. Injections of platelet-rich plasma, PRP. PRP injections aim to promote healing by using the patient's own concentrated platelets. 7. Surgical intervention. In cases where conservative measures fail, surgical options like subacromial decompression or rotator cuff repair may be considered. It's important to note that the choice of management depends on the severity of impingement syndrome and the individual's response to treatment. A physiotherapist can assess the specific needs of each patient and recommend an appropriate course of action. Special tests for impingement syndrome. 1. Knee test. The examiner passively elevates the patient's arm in forward flexion, assessing for pain, which may indicate impingement. 2. Hawkins-Kennedy test. The arm is flexed to 90 degrees and forcibly internally rotated, stressing the supraspinatus tendon and assessing for pain. 3. Empty can test, jaw-bay test. The patient raises the arms to shoulder level with thumbs pointing downward, and the examiner applies resistance, testing the supraspinatus muscle. 4. Drop arm test. The patient is asked to slowly lower the arm from an abducted position. Inability to control the descent suggests a rotator cuff tear. Physiotherapy management for impingement syndrome. 1. Early phase, pain relief. Ice and modalities for pain control. Gentle passive range of motion exercises to maintain mobility without aggravating symptoms. 2. Subacute phase, reducing inflammation and restoring function. Stretching exercises for the shoulder muscles. Strengthening exercises for the rotator cuff and scapular muscles. Manual therapy techniques for joint and soft tissue mobilization. 3. Recovery phase, functional rehabilitation. Progressive resistive exercises to enhance strength. Neuromuscular control exercises to improve shoulder stability. Activity-specific training to address functional limitations. Manual therapy for impingement syndrome. 1. Soft tissue mobilization. Massage or manual techniques to address muscle tightness and improve blood flow. 2. Joint mobilization. Gentle movements to improve joint mobility, especially in the shoulder and scapulothoracic joints. 3. Trigger point release. Focused pressure on specific points to release muscle tension. Electrotherapeutic modalities. 1. Ultrasound therapy. Promotes tissue healing and reduces inflammation. 2. TENS, transcutaneous electrical nerve stimulation. Helps control pain by altering pain perception. 3. IFC, interferential current. Aids in pain relief and can improve blood flow. 4. Heat therapy. Warmth applied to the affected area can help relax muscles and reduce stiffness. 5. Cold therapy. Ice or cold packs may be used to alleviate pain and swelling. Combining these approaches helps address pain, inflammation, and functional limitations associated with impingement syndrome. However, the specific plan should be tailored to the individual's needs and progression. Vote of thanks. Thank you for watching our video. We hope this information has been valuable to you. If you have any further questions or concerns, please consult our team for personalized advice.